Hey, everybody, welcome to episode 5 of Spill the Milk. Today, we're going to talk a lot about weight gain and the assessments that I do and the ways that I kind of troubleshoot this with moms. If you haven't met me before, my name is Nicki. I'm a registered nurse and I'm a board certified lactation consultant, and I've been helping moms and babies breastfeed for over 20 years. It's my favorite thing to do. So let's really get into this. And I'm going to dig all the way in. We're going to go over kind of how I do a weight assessment on babies when moms reach out to me for consultations, whether it's virtually or in their home, and questions that I ask, things I think that are important to know. We're going to talk a lot about discharge weight and the expectations, some things that could be said to you that may cause you to be confused and choose something other than what you want to do. We're going to talk about how many different scales you're using and how that can affect the weight in your baby. And I'm going to get really particular on mobile scales and give you some really good examples of why they're not the greatest tool. And then we're going to talk about the rules, what we expect your baby to gain every week. And it's based on their age. And then we're really going to get into those growth charts. We are going to dig so deep into those growth charts that you guys, your minds are going to be blown. But I'm going to do that at the end. So stick with me because this is going to be super important for you for just having regular breastfeeding knowledge and taking out some of those myths that we hear a lot about. So let's get into it. I'm super excited. All right. Your baby's birth weight is great. I love whatever your baby weighs when they're born. I think it's super special. But the weight I get really concerned about, and the one I want to know the most about when we're talking about questionable weight gain in a baby, is their discharge weight. So, what we know about discharge weight is that it's going to be less than birth weight. We know that. And we allow up to 10%. But I hear this so much, and this is something that causes me some really big concern. I hear moms tell me, well, I had to supplement because my baby has almost lost too much weight. It almost lost too much weight. It lost 9%. No, it didn't almost lose too much. It still lost 9%. 10% is something that we allow. So we shouldn't be treating that prophylactically. Your baby didn't lose over 10%. So there's no cause for concern. There's no reason to start doing something different besides supporting you with facts. And there's some babies that we even say up to 12%. Let's talk about why. We're going to talk about this one. Did you have a long labor? Did you have lots of fluids? Were you in labor for a really long time? All those things can affect your baby's true birth weight. And so then when we get into that baby who is still stooling, doing good, one wet, one poopy on day 1, 2 wets, 2 poopies on day 2, but their discharge weight is a little above the 10%. Can we look at the birth and see how baby was born and see kind of what happened where baby maybe weighed a little bit more because there were a little bit more fluids involved, or there was a traumatic birth where we had some swelling, maybe there was a vacuum delivery that caused a hematoma, all kinds of things. So if somebody tells you your baby has almost lost too much weight, that's not a reason. We allow up to 10%. 9% is fine. 10% is fine. Know your numbers. Know what that percentage is and ask that number. The other thing I run into a whole ton is moms are like, my baby's not gaining enough weight. I weighed my baby, they weighed X, and then this happened, and then I weighed him and they weighed this. And when I'm talking to a mom, I start to realize she's using several different scales. So there's going to be a big conflict in numbers just from the hospital discharge scale to your doctor's office scale. And when I worked labor and delivery, we would take a scale into postpartum rooms that wasn't even the one that the baby was weighed on initially at birth. That's usually like a giraffe bed is what we call them. The babies are weighed on there directly after birth. And then what they're weighed on is a mobile scale. And then when they go for their first doctor's appointment, it's the doctor's office scale. That's 3 different scales. An ounce matters. So we have to take all of that into consideration and take those things and kind of go, okay, in the grand scheme of things, how is this baby actually doing? Let's do the assessment of the baby. How many wets? How many poopies? How's it going? All those things. Then I get moms who buy scales from Amazon or wherever, or I do a home visit with my mobile scale. I tell a mom flat out, my mobile scale is likely not right. It's moved around a lot. It's put in the back of my car. It's pulled out of the back of my car. I may have hit the door on the way out, whatever. It's not as accurate as your doctor's scale who gets calibrated quite frequently. So when it comes to scales, especially mobile ones, especially ones you purchase, I'm not very trustworthy. So I tell you to do the test. Let's do the test because, again, if your baby's having adequate wet and poopy diapers, breastfeeding is going well, it's likely you have a scale problem. not a true weight problem. So we're going to test the scale. How do you test it? I need that scale to measure down pretty low. I really like scales that measure below 15 grams. And here's the problem. Not a lot of them do. 15 grams is equivalent to 15 mils of breast milk, which is also equivalent to a half an ounce. If your scale's not weighing that, you're not counting a half ounce feed. So how do you do it? It's super simple. I want you to grab a container, set the container on the scale, and zero it out. Then I want you to take 15 mils of breast milk, because 1 mil of breast milk weighs 1 gram. I want you to take 15 mils of breast milk and pour it in that container. See what the measurement is. You should get 15 grams. If you get it one time, great. Set it aside, do it again. I want you to do it 3 times. Then, if you're like, Nicki, it's not measuring 15, pour and pour until you get a measurement and start realizing my scale isn't accurate. It's just not accurate. An ounce matters in the first 4 months of life. An ounce matters. So I have moms that'll tell me, oh, my baby only transfers an ounce. Well, how do you know that? Well, because my home scale says they only transferred an ounce. Did they go through the 3 phases of eating? Yeah. Are they having adequate wet and poopy diapers? Yeah. Well, I don't think your scale's right. So scales definitely matter. But what's the rule? What's the rule on weight gain? And we're going to talk about all the way up until like 4, 5, 6, 7, 8, 9 months. So hang in here with me. Right now, we're talking about the littles. We want your baby to regain birth weight by the 2nd or 3rd week. The 3rd is kind of pushing it, but sometimes there's obstacles in those first few weeks where things might have been a little bit difficult, where we go, okay, let's wait. Baby can gain by the 3rd week, but we want that birth weight regained by the 2nd to 3rd week. We need to keep this in mind because, again, your baby lost weight, and babies don't typically start gaining weight until day 5. So 9 days of gaining. We're going to put that into perspective. I also want you to know that we go wrong so many different ways when we cause scale issues or when we don't investigate weight gain enough. So where do we go wrong? We prophylactically treat for, oh, baby's close to gaining enough, but not quite. And we start prophylactically treating. Well, what about just seeing where baby gets to? Because I don't know what that means for you. I need your number. I need to know the numbers. And we have a lot of moms who go in and they're like, I think things are going great. Things are going awesome. Having adequate wet and poopy diapers. And the doctor puts baby on the scale and they're like, ooh, I want them to be at X. And they're not there. Well, where's your X? What's your X? And show me your evidence to say that your X is on target. But prophylactically treating for just in case your baby's not gaining enough leads you down a slippery slope of supplementation, lack of milk supply, and all those other things. I don't want you to go there. We need to investigate. If your baby is just quite not gaining enough weight, sit down. You need to have a conversation with somebody. I would have the conversation with you. I would say to you, hey, how often are you feeding your baby? And if you said 9 times, I'd say, hey, let's shoot for 10 or 11. I would ask you, do you understand hunger signs and feeding cues? Are you getting to your baby early when they're hungry early, not when they're crying? And I would teach you all of those things about hunger signs and feeding cues. And just adding a few feedings in a day is all you really have to do. We don't have to go to triple feeding. That is a very complex thing for a very simple solution. The simple solution is just, hey, just feed the baby more. I'm going to show you some hunger signs and feeding cues, not triple feeding. So triple feeding and me and those words cause me my heart breaks when I have a mom who says she's triple feeding. Because what I know is she's likely being asked to do this unnecessarily. True triple feeding should only need to be for 5 to 7 days. Can we get there faster? Absolutely. What if we just had the mom feed the baby more often per day? That might get us there faster. Then the other thing is people tell you a lot of times that you're triple feeding because you have low supply. That's not true. Low weight gain does not always mean low supply, especially in those first few weeks. You have copious amounts of milk. It doesn't always mean low supply. Low weight gain can simply be you're just not feeding your baby enough. And we need to give you the opportunity to overcome some of that on your own with controlled weights. Up until 4 to 6 weeks, you've got a lot of milk. It's really kind of hard to have a low supply unless something drastic has happened. And so a lot of times low weight gain just doesn't mean low supply, and it doesn't mean triple feeding. It just means I just need to feed the baby more frequently during the day. Not more ounces, more frequently. So how much is your baby supposed to gain? Let's talk about this. The World Health Organization, and I'm linking the findings below, says, and I'm going to put this in grams as well just to help all of you moms out, that A baby from the age of 0 to 4 months needs to gain per week, 5.5 to 8.5 ounces, or 155 to 241 grams, up until around the age of 4 months. This isn't a boom dot mark 4 months. Some babies do a little different. Then from 4 months till about 6 months, it goes down 3.25 to 4.5 ounces per week, or 92 to 126 grams per week. Then from 6 until 12 months, it goes down even more, 1.75 to 2.75 ounces per week, or 50 to 80 grams. That's all per week, you guys. So if you have someone telling you your baby needs to gain 7 ounces per week and they're not meeting their expectations and they're a breast milk fed infant, that is not okay. That is not right. We even have, and this is average. So you guys have to remember, there's some babies that do okay with 4 to 5 ounces a week, or 113 to 142 grams per week. There's some babies that do just fine with that. The numbers I gave you are average. Okay, I'm going to post it. You're going to see the picture. You're going to see the link. You're going to be able to go and you're going to be able to get that study. But what we need to know is what your doctor tells you, what your pediatrician tells you, can affect growth charts, can affect what you think breastfeeding is supposed to be like, and how much milk your baby needs, and or how much weight your baby should be gaining. And if your doctor is one of those doctors that says 7 ounces per week, that you could fall short of their expectation. But guess what? The real number is less than that. And as your baby gets older, they gain less weight. And if we aren't supported with facts and evidence-based knowledge, we are going to feel like something is wrong. I get a huge number of consultations for moms 3, 4, 5, 6 months. Breastfeeding is going well. And we know that if a mom has exclusively breast milk fed for 4 months, we don't have to worry about her supply if she hasn't changed anything. We're not going to be concerned very much. We're letting mom kind of ride this out because she's in the good part of breastfeeding and her milk has been established, her baby's doing good, and she's doing well. But I get a ton of consults because babies, and this is the one that I'm like, oh no, they say, my baby's losing percentiles. My baby is losing percentiles. And it's causing so much concern that moms are going into these doctor's offices completely and totally just like loving their experience. They're finally on the easy side of breastfeeding. Baby's developmentally doing what they're supposed to be doing. Doctors saying all these amazing things about their baby. And then they go to chart them on this growth chart and they look at mom and say, your baby is losing percentiles. Well, I took a lot of time recently and I got into what a typical baby born weighs, and I charted that baby's growth using the World Health Organization average amount of weight gain per week. And I charted it on a growth chart. You guys, it's crazy what you're getting ready to find out from me. So I'm going to describe to you, and I'm going to read verbatim what the Center for Disease Control says about weight gain and their growth charts. And I'm going to read to you verbatim what the Center for Disease Control says about the World Health, or the WHO, growth charts. And there's some really important information in here that is necessary for you guys to know, because I don't think you know it. And knowledge is power. So get ready. Verbatim, CDC website. The growth patterns of breastfed and formula-fed infants are different. For example, healthy breastfed infants typically put on weight more slowly than formula-fed infants in their first year. Formula-fed infants typically gain weight more quickly after about 3 months of age. Differences in weight patterns continue even after introducing complementary foods. Linear growth patterns of breastfed and formula-fed infants are similar. The World Health Growth Standards, the WHO Child Growth Standards, consider the effect of infant feeding on growth by using breastfeeding as the norm. In creating growth curves, the World Health Organization considered the differences in growth patterns of breastfed and formula-fed infants. This one's important. In the World Health Organization child growth charts, a healthy breastfed infant is the standard against which to compare all other infants. All infants in the WHO, for World Health Organization sample, were breastfed at least until 12 months and predominantly breastfed for at least 4 months. You guys, this doesn't mean they're solely breast milk fed. This means there's probably some formula. Complementary foods were introduced at the mean age of 5.4 months, and you know the recommended is 6 months. The breastfed infant is the reference or normative model against which to measure alternative feeding methods for growth and healthy development. This is also true for other short-term and long-term outcomes. Using the breastfed infant as a reference model is consistent with U.S. dietary reference intakes. For those, human milk consumption and the average volume of human milk intake determine the norm for most infant nutrient intake. The CDC growth charts, they were referenced and developed to represent all U.S. feeding infants. Feeding criteria in the CDC growth chart were not identified. The CDC growth charts are based on primarily formula-fed infants. Again, you guys, nothing's wrong with formula feeding. We just need facts. Only about 50% of U.S. infants measured to create the CDC growth charts were ever breastfed. That might be one day, that might be twice a day. By age 3 months, only 33% of U.S. infants were being breastfed at all. That means there's likely some formula in there. Currently in the United States, most infants start to breastfeed. As a result, the CDC growth charts may not adequately reflect current U.S. infant growth patterns. The CDC growth charts also do not reflect the growth pattern typically seen in breastfed infants. Why is this important? You guys, it's important because you're measuring your breastfed infant. And if your pediatrician is not using a World Health Organization growth chart, it's going to look really bad. It's going to look like they're falling off. So I did a lot of homework. And with this homework came a lot of calculations and a lot of magnifying glasses because the growth charts I printed off were very, very, very fine print. But here's what I'm going to tell you. And for those of you who are just listening via audio, I'm going to have pictures to show as well. They'll be attached. But what I did was I took a baby that was born and I started doing basically charting its growth. I used a male infant. I used the male CDC growth chart. And then I charted on the World Health Organization growth chart with the same numbers. So now remember, we're going to reflect back average ounces per week of weight gain or grams per week of weight gain. 5.5 to 8.5 ounces per week for the first 4 months of life, or 155 to 241 grams for the first 4 months of life. So we had a baby that was born. Congratulations to this sweet baby. He was 7 pounds, 6 ounces at birth, 418 ounces. He dropped 10%, which is 6 pounds, 14 ounces. By the 2-week mark, he'd regained birth weight. I automatically put him back at that 7.6. And I charted this on the growth chart. Given that I printed directly from the CDC website, I'm going to show it here, but I'm also going to take a pic and link it in the description of the podcast if you want to see it. So every 2 weeks, I made sure that baby had gained 11 ounces because it's 5.5 ounces per week. So I charted this baby on a growth chart. I charted this baby gaining the average amount, 5.5 ounces every week for the first 4 months of life. And baby did pretty decently, kind of stayed on the same kind of curve. And then all of a sudden at 4 months, something happened. I did the correct thing and used World Health Organization standards of average weight gain for a breast milk fed infant, which is 3.25 to 4.5 ounces per week, or 92 to 126 grams per week. And I started that at 4 months. Guess what happened? Decline on the growth chart. By the age of 10 months, this baby wasn't even on the growth chart anymore. So I'm going to zoom in here and I'm going to let you see the picture. This baby was not even on the chart because this is the CDC growth chart. It's very, very important to know which growth chart your provider is using. Now, I did the same thing on the World Health Organization growth chart, just so that you could see the difference in what that baby actually did according to the World Health Organization standards. And this one is amazing. I love this one because, again, same numbers were used. Look at this sweet baby's growth chart. Look at it. It went from like the 12%, 50th percent, all the way up to 97th percent. Same amount of time because they used the correct numbers. Using the correct numbers is going to be helpful. So let's backwards. We're going to talk about how to solve this problem when you're seeing a pediatrician who may be using CDC growth charts or who may just have an obscured definition of what the average amount of weight gain is for a breast milk fed baby. Super simple. I want you to ask them when they tell you, when they say, hey, your baby's not gaining enough, I need you to ask them, how much weight do you want my baby to gain per week? They need to know the answer. If they don't, you're going to go ahead and show them exactly the thing that I've referenced down here, the World Health Organization growth chart standards or growth standards for a breast milk fed baby, 5.5 to 8.5. You guys know it. And you're going to say, why is your number different? Because it's causing me to think my baby isn't doing well based on the number you're giving me. Evidence-based information tells me my baby doesn't need to be doing that. Can we talk about where you're getting your information? And you can do this very kindly. And I think it's a great conversation to have. And then what you can do is you can simply go backwards in time. This is an easy math equation, not easy for me, but easy for some of you. I'm not a very good mathematician. But you want to know about what your baby should weigh at 12 weeks? It's super simple. 5.5 ounces per week times 12 weeks. That's how many ounces your baby should have gained from discharge weight. Discharge weight, not birth weight. That's it. It's about how much your baby should weigh. It's very simple math. So you can go in with those numbers. You can go in if there's been some conversations about possible supplementation, possibly doing triple feeding, possibly this, possibly that. You can go in with knowledge ahead of time. What you can also do is you can share with your provider exactly how much anxiety it's causing you with the scale. And you can wait to weigh your baby until after you have a conversation with your provider. You can have the conversation with your provider and say, hey, how much weight are you expecting baby to gain? They give you a number. You show them your number. You guys talk about it. There's a good possibility that if you're breastfeeding and you're 3 months in, you're one of only 2 or 3 other moms that may be actually exclusively breastfeeding in his practice. And he doesn't even know because he doesn't have very much experience. Or she doesn't know because she doesn't have very much experience dealing with a 3-month-old that's exclusively breastfed. And you actually may change this for them. They may dig in more and they may be able to help those other moms more. So I hope you've learned something. This has been a long one, but this is one of the best ones that I can give you to build your confidence and your knowledge to support you in your decisions, whether you're going to choose to top up, whether you're going to choose to give formula, whether you're going to triple feed. All those things may just not be necessary. So dig into it. Get to know average weight gain, get to know your growth charts, get to know your pediatrician and their viewpoints. Share your viewpoints. But remember, you're doing an amazing job. Thanks for spending time with me. This has been episode 5. And so far, I'm loving everything that you guys are saying and commenting. Join me on my Patreon page for more in-depth discussions on things. But again, thanks so much for hanging out with me. I hope your day is amazing.